Nicola who joins us from London, our health correspondent. Nicola, what more does the study tell us about vaping and COVID-19?
Well, they're quite dramatic figures, aren't they, Maria? This was a study that's been published in the Journal of Adolescent Health. And as you say, it was involving just over 4,300 young people. It was an online survey where they were asked, did they smoke, did they vape, or did they do something called dual use, which is smoking and vaping. And it showed that if they did that, their chances of getting COVID-19 were increased by 7 times, and if they vape, they were increased by 5 times. And of course, the thing is, many young people think that they're not at risk of COVID-19. They think that because if they're going to get it, their symptoms are very mild and they're not really going to be badly affected by the virus at all. But if they smoke and vape, this isn't the case. Now, there's a couple of theories as to why this could be happening. One of them is the fact smoking or vaping, they're bringing their hands to the mouth and then down again repeatedly, and of course we know that's one of the ways of spreading the virus. But Dr. Deirdre Gilpin, who's a microbiologist and an expert in respiratory infections from University of Belfast, she says another possibility is the fact that it's known that the virus, the SARS-CoV-2 virus, gets into healthy cells via something called ACE2 receptors on the outside of these cells. And it's known that smokers have more of these receptors. And we think it's the nicotine that's involved in this. And of course, there's also nicotine in e-cigarettes. And that's possibly why people who are smoking and vaping are becoming much more vulnerable to getting to COVID-19. And also, it's known that e-cigarettes do make lung cells more vulnerable to any type of bacteria or virus. It can make these pathogens much more toxic. So she thinks that's another possibility as to why vaping is having such a detrimental effect on young people.
And Nicola, we've seen vaping advertised as a way to giving up smoking. Will that change now?
Yeah, well, that's something that certainly Dr. Gilpin, and also there's an editorial in The Lancet saying the same thing. Now, some countries have actually banned e-cigarettes. There was a lot of controversy in the US, particularly last year, because of young people who didn't smoke but had taken up vaping because they thought it was trendy, they thought it was cool. So you had all these young people beginning to be addicted to nicotine through vaping, whereas, as you said, it's mainly being presented as an alternative to smoking. Certainly here in the UK, Public Health England say that it's safer than smoking, and if you're addicted to nicotine, you should vape rather than smoke. But of course now a lot of evidence is coming out about the effects that e-cigarettes are having on lungs. Some countries like Turkey have actually banned them. And it seems that scientists are saying, certainly during the pandemic, we should be encouraging people to neither smoke nor vape because of the effect that it's actually having on your lungs and making you vulnerable to the coronavirus.
Indeed. Nicola, thank you so much from London with that update. Thank you.